Okay, good afternoon, everyone. Once again, I have to begin by making the sad announcement of yet more lives lost due to COVID-19. 9 more people lost their lives this time in the last 24 hours. 9 more people being mourned. My deepest condolences go to their friends and their families. For we are at a crucial juncture now in Northern Ireland. We all need to stick firmly to the social distancing regulations to keep staying at home whenever possible. I don't underestimate for one moment how difficult the restrictions have been for so many of us. But I am immensely proud and reassured of how the people of Northern Ireland have heeded the advice. By staying at home, they have been saving lives. But there's also pressure on those of us in political leadership to chart a way forward, to reassure people that there will be a life after lockdown. I get that, because what we are doing now is tough, and the longer it lasts, the tougher it's going to get. And people want and need to have hope. In common with governments across the world, our executive colleagues and I have to strike a balance. We need a frank public debate about what lies ahead for us as a society. We need to openly spell out the choices that will have to be faced. We also need to make sure we don't send out the wrong signals, to avoid giving the impression that the restrictions are going to be significantly eased anytime soon, because they are not. And we need to make sure that as an executive, we don't take decisions that risk lives or undermine public safety. So let me make 3 points to assist that public debate that is very needed. I want to be totally frank and open about all of this. Firstly, the widespread social distancing measures in place are still vitally needed to save lives. COVID-19 is still very much with us. There will be no big bang moment when all these restrictions go away. The consequences of doing that would be catastrophic. Social distancing will be part of our lives in some form for months to come, maybe even years. So until we have a widely available vaccine, there will be no full return to what only a few months ago was normality. So please keep digging in and doing the right thing. Secondly, decisions will have to be made at appropriate junctures as to what precise form the social distancing should take, including whether individual regulations should be amended. These will not be easy or risk-free decisions, so it's very important to make that clear. What we will be aiming for in many cases will be the least worst option. Easing restrictions brings with it the potential for the virus to spread further, for more people to be infected, for more people to die. Sticking with an indefinite lockdown also brings serious costs for society and for individuals, and we have to acknowledge that. Lockdown takes a particular toll on the old and the young, the most vulnerable, the sick, and the most deprived. It is only those people that must remain at the forefront of our minds when any possible adjustments are being proposed. That's why I say there are no risk-free or pain-free options. So that brings me to my third and final point. We have to tackle this together, cautiously, patiently, and step by step. And by that, I just don't mean the executive, but this entire community as a whole. Decisions cannot be rushed. They will have to be taken in line with the best expert advice and in close consultation with colleagues across these islands. I'll conclude with some of the words I used earlier today in the Assembly about the lessons emerging from this crisis. It has certainly underlined more than anything else I can ever remember, just how essential health and social care services are to this society. Despite the current challenges, our health service is looking after us all and keeping us safe, and we really need to look after it better. And by that, I'm referring in particular to the last 10 years of financial squeeze. We can't keep running a health and social care system on empty in future, barely getting by, living hand to mouth on single-year budgets, and failing to make the necessary transformational changes to ensure we properly meet the needs of the population. So let us resolve to do better for the health service. A health service that has stood so firmly by us, so to fund it properly long term and transform it for the better. Let that be one of the lasting legacies of this period we are living through. Let that be the true lasting tribute to those we applaud every Thursday evening. I'll now hand over to the Chief Scientific Advisor, Professor Ian Young.
Thank you. So today I would like to provide an update on the course of the epidemic and to discuss some aspects of the modelling and the key factors that we will seek to look at in the future in order to judge its course. As has been made clear, we have now passed the peak of the epidemic in terms of cases, hospital admissions, ICU occupancy, in terms of this current first wave. We'd been unsure whether there would be a rapid fall in those cases or a slow fall, and it's now clear that while cases are falling, they are falling very slowly indeed. How do we understand that? The key to understanding it in scientific terms is to appreciate the importance of a number which has been mentioned more than once in recent times, the basic reproduction number, also known as R0 or R0. What is R0? R0, to put it simply, is the number of individuals who are infected by a single case of COVID-19. So if one person infects 3 other individuals who then have the virus, then R0 is said to be 3. The key value for R0, and one that I hope everybody will bear in mind and be aware of in the months to come, is 1. When R0 is above 1, the epidemic will increase in all of its aspects. When R0 is below 1, then we will have the epidemic under control and cases will begin to decrease. Before the introduction of social distancing and the other restrictions, the value of R0 was just under 3. So for each case, 3 more cases developed in the community. The main factors which drive R0 are the number of contacts which we have with each other, the closeness of those contacts, the duration of the contacts, and the extent to which we touch hard surfaces which other people have touched. So whenever we introduced social distancing, recommended hand washing, advised people to stay at home, the purpose of that was to try to reduce R0. And we have been successful in doing so, so that R0 currently lies between 0.8 and 0.9, meaning that each person with COVID infects less than 1 other individual on average. Whenever R0 is just below 1, then the numbers of cases that we observe, the hospital admissions, the ICU occupancy, the deaths, all fall slowly. So what we're seeing at present fits exactly with what we anticipate from the value of R0. What does this mean for the future? Well, the first thing to say is that any relaxation of the current restrictions will have a tendency to increase R0. There's no relaxation which will be without risk, and we will need to continue to monitor R0 very closely. There will be measures that we can take to reduce risk, and chief among those will involve more widespread use of testing, isolation of individuals with symptoms or who test positive, and contact tracing. But the balance will lie between how effective those measures can be and the extent to which there are a large number of cases in our community. At the moment, I've talked about us being on a knife edge, and there is indeed a knife edge, and the knife edge is maintaining R naught at that key value of 1 or less. At the moment, we are just below it. It's important that people continue to adhere strictly to current social distancing measures, to staying at home where possible, and to frequent hand washing in order to try to reduce the number of cases further and make it less risky for us to begin to think about releasing restrictions in the future. Thank you.
Thank you, Professor Young.
Good afternoon, gentlemen. 24 hours ago, your ministerial colleague, Edwin Poots, stood on that stage and said that he would like to see churches, garden centres reopened, albeit in a gradual way, but he was advocating for that. What's your view of that?
Tracy, my view of that as Health Minister is the fact that that conversation and those conversations will be had with executive colleagues, supported by the medical and scientific advice that comes from the Chief Medical Officer and the Chief Scientific Advisor. So as Health Minister, I'm not going to stand here today and pick off one suggestion one by one and make a decision here at this minute in time. Those will be a collective responsibility and a call by the executive that will be supported by the advice and guidance coming from the Chief Medical Officer and the Chief Scientific Advisor.
Good afternoon, everybody. Two questions. One, firstly, for the Minister Robin Swann. We get different COVID-19 figures from different bodies. Is there any way we can have more detailed statistics, and in particular, what has happened to the dashboard that was talked about? And a question for Mr. Young: is the lockdown breaking down in piecemeal fashion, with people making individual decisions day by day?
Okay, thanks, Stephen. And in regards to the daily update that comes out, those are the public health agencies' figures that we produce through the Department of Health under a collaboration of data from a number of I suppose sources in regards to testing figures exactly. So they're pulled together in that one piece. The dashboard we envisage will be up and running tomorrow again, which will give a more detailed breakdown of specific in regards to number of cases and geographical breakdown. But I think what is the main source of information that we do need to look to is the NISRA bulletin that comes out on a weekly basis, because although there is a time lag there, they are the official body for reporting deaths in Northern Ireland, and they are the ones who conduct that detailed piece of analysis in regards to death certificates and the data coming forward. We supply, I suppose, for surveillance monitoring numbers on a daily basis that allow us to track where the disease is, where the virus is, and the effect it's having.
In terms of the second question, so we have a variety of data which help us to assess the extent to which the public are sticking to social distancing and the other restrictions that have been applied. Most of that evidence suggests that there is a reasonably good continued adherence to the restrictions, but you're right to highlight that there's some evidence, particularly around traffic usage, which seems to suggest that adherence is declining slowly. So I guess the message I would like to give today is to ask people to reflect on that, to reflect on where we are, and to understand the importance of renewing the commitment to the current measures. They're in place for a good reason, and at an appropriate time point, decisions will be made about which measures can be relaxed.
Hi, can I ask the Minister what provisions are being made for cancer surgeries, red flag referrals and cancer screenings, given the announcement made by your counterpart in England at the end of last week?
Thanks, Alison. In regards to how we re-engage a lot of our services, especially in regards to the screening programmes that were stepped down, not every screening programme was stepped down during our surge preparations. We're working at this minute in time across our Health and Social Care Board and in conjunction with the trusts to make sure that when we re-engage services we can make full utilisation of the available capacity that is there, so we can actually use it strategically. So what I've just come, I've actually came from the ad hoc committee in the Assembly, and what I've updated them is when we start to re-engage a lot of our medical services that were actually stood down during the surge preparation, don't expect things to simply return to normal as to where those services would have been performed, or where they would have been performed, or when they would have been performed, because over the next period of time, while we still keep a capacity available to manage COVID-19 but also prepare for a potential second surge, that we have to utilise that spare capacity strategically so we can re-engage most of those services. Because what has to be remembered as well, when I took over this post on the 11th of January, we had horrendous waiting times. The key focus for us as an executive and the Department of Health was actually how we started to tackle our waiting times across all specialities and all conditions as well. That hasn't got any better while we've had to step down some of those surgeries. So the next piece of work that we do in re-engaging those services has to be even more challenging than when we would have envisaged 2 or 3 months ago had we not had to face COVID-19 at the same time.
Hello, Professor Young. It's Michael McHugh from PA. Here, I just wanted to ask you, please, what is your assessment of, and forgive the pronunciation, of remdesivir and other potential treatments and their ability to save lives?
So there's considerable work going on globally around a variety of novel treatments which may help to reduce complications of COVID infection. We've heard in the last couple of days about some very positive results about remdesivir, certainly in terms of reducing the period of infection, and we're waiting for fuller data on that to be published. Patients in the UK have been able to access remdesivir in the context of clinical trials, and there are a number of clinical trials proceeding both in primary care, in hospitals and in the setting of ICU, and all of those trials have been opened in Northern Ireland. There are a wide variety of drugs which are being tested and tried in the context of those trials, and as many of our patients as possible will be offered the opportunity to try those experimental treatments. The remdesivir results sound positive, but it's still at an early stage, and supplies and access to that particular agent are extremely limited at present. But there are a number of other drugs which are much more readily available, where we expect to have results available in the next few weeks.
Okay, thank you. Thanks.